May is Stroke Awareness Month, and Gutters and Health System is urging you to learn more about the symptoms of a stroke. And joining us to talk about that and rehab is Dr. Christine Brose. Good morning. Thanks for getting up with us.
Good morning. Thank you for having me.
And stroke is something I think a lot of people associate as we grow older, but they really can strike at any time.
Absolutely. And, we have patients on our rehab unit who are in their 20s and 30s.
Wow. So what do we need to be aware of when it comes to stroke? What should we be looking for?
I think the number one thing, like you said, is it can happen to anybody. This is no longer a disease of the elderly. If you think someone might be having a stroke, the key things to look for would be weakness, either in an arm, a leg, or both, trouble speaking, maybe some facial droop, trouble with balance. Those are often the first things people see.
And then what should you do? Is this a call to 911? Do you get in your car and head to the emergency room? What do you do?
This is absolutely call 911. Strokes can be devastating, and you don't want to be caught in the car with your family if something goes wrong.
Okay, so then what happens next? You have a stroke. I mean, obviously there are different degrees of severity when it comes to stroke, but what is the most likely course of treatment?
Yeah, for every patient it's very different in terms of what happened to them. When they arrive in the emergency department, obviously our ER physicians will do a wonderful job evaluating them. There's different kinds of strokes. There's strokes where the brain doesn't get enough blood, and then there's a bleeding kind of stroke where the brain has too much blood, and the treatment initially is very different. I'm a rehab specialist, so I see patients a few days or weeks down the road from that and help them recover, but we all have a role to play in this.
Can you completely rehab back from a stroke?
It depends on the person. Some people get to 100%, not everybody does, and we do know the fastest recovery happens in the first few months, so this is not something that's going to happen overnight or in a week or two, but I've seen people years out from a stroke who are still making recovery.
Wow, and I'm reading here that for someone who has had a stroke, the chance of a second stroke within 5 years is as much as 30 to 40%.
Absolutely, and the highest risk is actually within the first few months after that initial stroke.
But again, rehab is the best. Is that the best way to prevent that second stroke, or is that just the only course of action we have to hopefully return to back to normal pre-stroke?
Well, in terms of stroke prevention after you've had one, figuring out what the cause of the stroke is obviously important. Smoking, high blood pressure, untreated diabetes, untreated high cholesterol, these are the kind of things that are triggers for having a stroke. And so when the patient is either on rehab or if they end up in a nursing home or on the acute part of the hospital, it's the physician's jobs to figure out what the risk factors are and figure out what we can do to modify those. It often does include medications, but lifestyle changes can be hugely important with this too. Yeah,
living a healthy lifestyle, just the way to go all around.
Yep,
Dr. Brose,
absolutely.
Thanks so much for joining us this morning. Again, May is Stroke Awareness Month, something you should probably speak to your physician about at your next well check. Thanks so much.
Thank you.
All right, we'll be right back.